Welcome back to Section 4 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program-inspired course for non-specialists. In the previous lessons, we've explored how to recognize the symptoms of depression, screen using the MH-GAP guide, assess depression severity with the PHQ-9, and conduct a clinical interview to gather a comprehensive patient history. Now that we've assessed the individual, we move to the next essential step: developing a personalized treatment plan. A treatment plan is the roadmap to recovery. It's how we ensure that the person receives the right type of care, tailored to their specific needs, situation, and preferences. Why is a personalized treatment plan important? Depression is a complex condition with many layers: biological, psychological, and social. A personalized treatment plan takes all these factors into account and helps provide a holistic approach to care. It's not a one-size-fits-all solution. Each person's depression is unique, and their treatment should be too. A well-developed plan is also a collaborative effort. The person with depression should be actively involved in decisions about their care. This builds trust, encourages engagement, and empowers the individual to take an active role in their recovery. How to develop a personalized treatment plan? A comprehensive treatment plan includes several key components: goals, interventions, and follow-up. Let's break them down. 1. Setting treatment goals. Start by asking the person what they want from treatment. Setting goals that are realistic, measurable, and specific helps both the individual and the care provider know what to expect. Goals should focus on symptom reduction, improving daily functioning, and enhancing quality of life. Some examples of goals include: I want to be able to get out of bed and go to work or school every day. I want to feel more hopeful and less tired. I want to reconnect with my family and friends. These goals give both the person and the care provider a sense of direction. 2. Choosing interventions. Once the goals are clear, the next step is deciding on the interventions, the actions and strategies that will help the person meet their goals. There are several types of interventions for treating depression. A. Psychoeducation. One of the first steps in treatment is providing information about depression, what it is, how it affects the body and mind, and why treatment is important. Psychoeducation helps reduce stigma and helps the person understand their condition. B. Psychological interventions. For many people, talk therapy is a key part of treatment. Cognitive behavioral therapy, CBT, is one of the most widely used approaches, helping individuals identify and change negative thought patterns that contribute to depression. For those in rural or remote settings, support groups or peer counseling can also be valuable. C. Medication. If symptoms are moderate to severe, antidepressants may be part of the treatment plan. The most commonly prescribed medications are selective serotonin reuptake inhibitors, SSRIs, which help balance chemicals in the brain that influence mood. As a non-specialist, it's important to recognize when medication might be necessary and ensure the person is referred to a healthcare professional who can prescribe and monitor the medication. D. Lifestyle changes. Encouraging healthy lifestyle choices, such as regular physical activity, improving sleep patterns, and eating well, can complement other treatments. Physical activity, in particular, has been shown to help reduce symptoms of depression by boosting endorphins and improving overall well-being. E. Social support. A strong support system is crucial in recovery. Encourage the person to reconnect with family or friends. Support from loved ones can help reduce isolation and offer emotional strength during the recovery process. 3. Monitoring progress and follow-up. A treatment plan is not static. It should be regularly reviewed and adjusted as necessary. Schedule follow-up appointments to monitor symptom improvement using tools like the PHQ-9, assess side effects of medication, provide encouragement and emotional support. It's important to stay in touch with the person, offer reassurance, and adjust the treatment as needed. If one intervention isn't working, be open to trying another approach. Let's pause for a moment of reflection. Think about a time when you supported someone through a difficult situation. How did you set goals together? and create a plan for success. What can you do to ensure that the person with depression plays an active role in shaping their treatment plan? A collaborative approach leads to better engagement and results. A real-world example, Musa, a 45-year-old man in Lagos, has been struggling with depression for several months. His treatment plan includes 1. Psychoeducation. Musa learns about depression and how it's affecting him. 2. Psychological intervention. He begins CBT with a trained counselor. 3. Medication. The doctor prescribes SSRIs to help balance his mood. 4. Lifestyle changes. Musa commits to regular walking and aims to sleep better. 5. Social support. He reconnects with his friends and joins a local community group for support. After a few months, he returns for a follow-up where his symptoms have improved and he feels more connected to others. This personalized plan helps Musa address his symptoms from every angle: mind, body, and spirit. In summary, a personalized treatment plan addresses the unique needs of the individual and includes clear goals, appropriate interventions, and regular follow-up. Effective treatment includes psychoeducation, therapy, medication, lifestyle changes, and social support. Collaboration is key, both with the person receiving treatment and with the wider support network. In Section 5, we'll move forward into practical techniques for psychosocial support, how to offer emotional and practical support, especially during difficult times. But before we continue, here's a final reflection for today. How can you ensure that the treatment plans you develop with individuals are realistic, empowering, and tailored to their unique needs and circumstances? Let's continue working together to build compassionate, effective care for all.